In the contest of deadliest bugs, the new coronavirus doesn't even come close to the old familiar flu.
The flu, which has been around forever, so far this season has infected 19 million people, caused about 180,000 hospitalizations, and killed 10,000 people, and that's just right here in the US. And nobody's buying masks, closing borders, or stopping flights for that.
China also set a world record in sharing genome information about the virus with the world. So far, only about 150 cases have been confirmed outside of China. The World Health Organization has called China's response a model.
The World Health Organization is not recommending taking any measures that it says will unnecessarily interfere with international trade or travel.
The speed with which China detected the outbreak, isolated the virus, sequenced the genome, and shared it with WHO and the world are very impressive and beyond words. So is China's commitment to transparency and to supporting other countries. In many ways, China is actually setting a new standard for outbreak response, and it's not an exaggeration.
According to the United States Centers for Disease Control and Prevention, there are confirmed novel coronavirus cases in 25 countries now. According to data released just today, the death toll in China has surpassed 630 people, with more than 70 of these deaths occurring within the past 48 hours. Now, the total number of confirmed cases in China has surpassed 31,000. Now, the Special Administrative Region of Hong Kong just reported its first death from the virus on Tuesday, adding it to the list of locations affected. But here are the other countries where there are confirmed novel coronavirus cases. Australia, where as of this morning, 15 cases have been confirmed by the government. Belgium, where the first case was confirmed 3 days ago. Cambodia confirmed its first case January 27th, and Canada has 4 confirmed cases as of Wednesday. Finland, 1 confirmed case, a Chinese tourist. France, the first European country to be affected now, has 6 cases. In Germany, 13 cases. India, 3 cases. Italy, 2 cases. Malaysia, as of today, has 15 cases. Nepal has 1 case, a man arriving from Wuhan. In the Philippines, officials confirmed their 3rd case Wednesday. Now, Russia, 2 Chinese nationals infected. Sri Lanka, 1 case. Singapore, 33 cases. Spain and Sweden both have 1 case, and Thailand has 25 confirmed cases as of Tuesday. Now, the Republic of Korea, 23 patients as of yesterday. The UAE, 5 cases as of Saturday. And the United Kingdom confirmed its 3rd case on January 31st. Now, in terms of here in the United States, 12 confirmed cases. And finally, Rick, in Vietnam, the number of infected people was brought to 12 on Thursday.
The death toll from the coronavirus continues to rise in China. We saw a hospital open up in just 8 days. The stock market took a huge hit. Chinese New Year celebrations were pretty much ruined, and very strict travel restrictions took effect. But I want to rewind a bit at some very crucial events that took place before we actually got to this point right now. Now, a little under 2 weeks before the World Health Organization alerted the public of the coronavirus outbreak, an artificial intelligence company was already sounding the alarm. Now, that company was Blue Dot, which used AI-powered data to analyze information from multiple sources to identify disease outbreaks and forecast how they may spread. Now, in fact, on December 31st, the company actually sent out a warning to its customers to avoid Wuhan, where the virus originated. And if you recall, the World Health Organization didn't send a warning until 9 days later on January 9th. So is this a global pandemic or just a minor scare? Well, the jury's still out on the coronavirus, but the math does point to signs that the worst is yet to come, which is why it's so shocking that another AI-powered simulation is predicting that the coronavirus could actually infect as many as 2.5 billion people within 45 days and kill as many as 52 million of them. Rick, kill 52 million people. Right now, the world is acting with such an urgency with the confirmed deaths at 636. Now, the shocking part is that the results so far have successfully predicted the following day's publicly released numbers within 3%. So that's a very accurate AI prediction. But before everyone freaks out, there's also some good news here. Now, these coronavirus predictions are neutral net, assuming conditions do not change. But doctors say conditions will change and are in fact changing. And the most important change is the mortality rate. Now, let me explain to you this way. If a high number of the infected people actually develop only mild symptoms, these patients may not report their illnesses. So therefore, the actual number of people infected in China may be a lot higher than reported. And that also means that the death rate, which is currently estimated at 2%, may be much lower. So although wider spread of infection doesn't seem like a good news, it does actually mean that the death rate is only at 0.5%. And that obviously changes the spread of the disease. And despite all medical efforts, the coronavirus is likely to go global, but because of medical efforts, it's also unlikely to be as deadly as predicted. And Rick, I also want to mention that the flu, which has been around forever, so far this season has infected 19 million people, caused about 180,000 hospitalizations, and killed 10,000 people, and that's just right here in the US. And nobody's buying masks, closing borders, or stopping flights for that. In Washington, Cy Tavinger, RT.
Well, it boasts to have the world's best healthcare system. The US has been one of the first countries to issue sweeping travel restrictions, clearly against the WHO's recommendations. When there was only one confirmed case at home, the US declared a national emergency. Well, the US is free to choose to do so, but let's not forget when the H1N1 flu broke out in 2009, also an international health emergency, US authorities estimated that there were some 61 million people infected and 12,000 people killed between April 2009 and April 2010 in the US. And it took the US administration more than 6 months to declare a national emergency. US officials were still welcoming people to explore America.